you for being here. It has been a great set of presentation. My name is Mathias Ekman, and I'm part of the Western Europe team for Microsoft covering health and life science. And often when people ask me, what are you doing in your life, I often remember the time when I was in the school with my daughter, and she was like 7 years, and the other friends are asking, what are you doing at Microsoft? And she said, no, Dad, I can answer. He's like building hospitals, and he's doing it in Minecraft. So, on the theme of transformation, maybe the future of the hospital will be in Minecraft, who knows? So, as we, in the previous section I've heard, I think all of us knows that there is a change and transformation that will happen. And in especially this area of health and life science, we see that the entire supply chain will change. And of course, we have heard discussion on different threats and different ways to try to cope with this. But I think one of the key things that is important to understand is that in the future, almost every organization will be a digital one or provide digital services. And that is, I think, a key thing from us when we are discussing these things, is that you need to start to think about technology, if it will disrupt you or if it will enable you. And I think in this digital ecosystem, it's extremely important also what type of partners that you partner up with, especially around this disruption versus enablement. Because the things that is happening now is almost like an invisible revolution that is coming. And I should say that there is indeed a very specific thing that is different from this change to previous change, because previous transformation has mostly been driven by Moore's law. That is, compute power has increased every 18 months. So if you think about the phone and different things, that has been some kind of update in some type of hardware. The change that we are entering now is mainly driven by software. And that, I think, is a unique thing to start to think about, because that is not limited to the Moore's law, this 18 months. Just to give some example of numbers, 38 million and 76 seconds. Anyone that dares to say what that is? 38 million is the number of books in the state congress in Washington in US. 76 seconds was the time it took to translate that, all of that amount of information from English to Russian. So often when we think about a lot of data and time, I often take this as an example. I mean, a hospital or a healthcare organization or pharma organization, it's on that level. So the speed of technology is extremely high today. And often the follow-up question is, yeah, but how good is that translation then? Then is, of course, that is my second example. 5.1% is the world record for the moment for taking spoken English and capture that and write it down as a text. And that error percentage is better than an extremely trained human. So what is happening also is that technology in very specific scenarios is becoming on the same level as humans. That also, I think, is important to understand. And it started with vision, this is speech, and last year, in fact, that for standardized knowledge text, that is, you have a lot of text and you have a set of questions. Now AI and machine learning is better than human and giving the answer on what the intent of the text is as well. And the last one is, for a few years ago, Microsoft just updated the way that we are processing genomics mathematics. And the speed up of that was 7 times. That happens over a day. And I think that is important to understand that what that means is that things that previously took 1 week can be done in 1 day. So things that people couldn't wait for in primary care or in the pharmacy, that basically is moved into the point of care at the bedside. That is also a key thing, I think, to take into account of. And of course, underpinning all of these things is some kind of artificial intelligence. And I should say that in health and life science, maybe this is one of the most important things to have. So the big question for all of you and us is, of course, how do you create this digital intensity, and how do you do it on a continuous basis? And I should say that, in fact, the formula is quite simple. It's the speed of adoption times your own tech capability. But the most important here is to think about what I said around the ecosystem, because if you start to invest in partnership, where you have a partner that eventually will disrupt you, this is the wrong way to go. So it's even important to have trust in technology, but it's extremely important to have trust in your partner's new business models. And the second part, of course, is what should you do that is unique for yourself? And if you can see that there exists a lot of technology like health bots or collaboration techniques that is commodity, you need to embrace that, because, as I said, the shift of pace is going from a technology shift of 7 to 10 years that is more than 4 years. So it's extremely important also to start to embrace things from a speed perspective. And the second thing is that up to now, data has been in very silent-based system, but technology that we see it today is extremely much better of gathering data. And for us, we often talk of these 4 digital pillars that we see that companies start to try to get better and better on. And the big question here is not that, yeah, we have done engagement with patients before, or we have optimized for employees. The big question is, do you have a continuous feedback loop that on a daily basis captures information in one of these different settings and move it back so your employees or Salesforce can make that decision the next day? And I will just walk you through a set of examples just showing that technology is in fact moving into the point of care in a much higher pace. And the first thing I think is extremely interesting is how could you help children putting the needle when you give the chemotherapy. At Karolinska in Stockholm in Sweden, they have started to explore if this robot pepper can be a companion so that the children can do the thing that the doctors will do on them before, and they see that they are much more calmer. And the second thing is, could you in fact put on some kind of glasses on top of the children so they are swimming around or doing something in the air or whatever they select. And also there they see that the procedure becomes much better. And digital pathology was mentioned, and of course we see that artificial intelligence will help you do the diagnosis, but we do see that you can move it even further by having technology on you when you do the slicing of the specimen that you have taken out. It's possible later on to reproduce that into a digital copy. And then of course, if you are able to have this real-time data feedback, then you can start to understand what type of patients are reacting to my specific medicine, compare how the specimen is looking out and where the cancer was. So that feedback loop, by making things digital much faster, is increasing the probability for precision medicine. And of course, in the case of doing planning for radiology, it's also important that you can do this annotation of the pictures. And we see that technology can have an extreme speed up in the way that they are using it. And it was mentioned in the beginning that it's not so much about artificial intelligence, more like how AI can improve humans. So from us at Microsoft, we talk much more about assistive technology. And a great example is that if you look at breast cancer, doctors have an error percent of 3.5%. The AI have an error rate of 7%, that is higher than human, but if you combine that, the doctor plus the technology has an error rate of 0.5%. So this way of thinking about technology as assistive can have a huge speed up, huge decrease of error rates. And the tricky part is then, could we use technology to try to bring in the patient? Because often we talk about patient-centric care, but a lot of the healthcare personnel taking decision, especially around the multidisciplinary meeting, has never seen the patient. So can we bring the patient into the decision making? Can we make that data more structured so we can feed that back to real world data so you as pharma companies can learn more about how was the situation for the patient before we started the treatment and how did it react. So I will show a short movie around one pilot that we have done in one hospital.
My name is Asif Halimi. I work at Karolinska University Hospital in Stockholm. I'm a specialist in general surgery, working in pancreatic unit. In previous years, you had a lot more physical contact and physical communication with the individual. With the increasing number of patients, you lose this physical communication. Human interaction is missing today. So to improve the system and the solutions we have today, the whole idea was to bring the patient in our conference room, increasing the patient communication.
Doctors tend to make decisions around patients that they perhaps never have seen. It becomes so extremely important to work together between traditional medicine and information technology, because data is the new scalpel.
Now you see a face in front of you and you know a lot more about the patient's physical condition, a set of wall of text, health history, previous operations, lab results, which data examinations were done with the system. We would see all these parameters right in front of us on a screen, and it is a safe and secure system to use, making it easier for us as doctors to collaborate with other colleagues across different specialties. And since we are better prepared, we have more information, increasing the feedback loop, providing the patient better healthcare. My personal goal is to be a better doctor today compared to what I was yesterday. It is impossible to do it alone.
And that is, in fact, one of the biggest trends that we see, that the healthcare system has moved away from being a system of records to go into some kind of insight, but now trying to be the position of system of engagement. And in the previous discussion, there were mentioned around these bot technologies. And this is a really good example, I should say, where you should not invest in silo-based solution again. Because if you thought it was difficult with all these apps that you have, if you start to embrace a lot of different bot technologies, you need to implement, for example, GDPR every time when you build a bot. And that is one of the key offerings from Microsoft, of course, is that we have the platform, but you are the end company that is using and building and branding the stuff, but we can take the responsibility, for example, for the GDPR perspective in the platform. And Microsoft, in many aspects, our success is your success, because we have selected the business model basically that we are partner driven. So the success of Microsoft is not how cool we are or how good our technology are, it's how you can embrace that and how can you increase value for that. And some example of global collaboration is the work that we are doing with Novartis Foundation, for example, try to combat one of the most ancient diseases in form of leprosy. Another example is together with DNA Nexus and St. Jude in US, where we are building the largest DNA database for children with cancer. And the aim of that database is in fact that other organizations could do research on top of that and include that type of data in their own real-world data strategies. And together with Takeda, we for 1 year ago started a combat around rare diseases for children, try to decrease the time it takes to know if you have these rare diseases that is on average 5 years, to try to see if you can use blockchain technology and AI to remove part of that investigations. And the last thing that I will mention also is the work that I think is extremely interesting when we talk about what things can be digital, is the work that we are doing with adaptive technology. And basically the idea is to build a digital representative of the immune system. So basically from a blood sample, sequence that, be able to have an AI model that basically will say that the probability for you to have this type of cancer is this percentage. And this is mainly based on work and looking at the T cells, for example. So that I think is a good example showing that if you can do that, we are really moving the needle of preventive care. And of course, as I mentioned, this cannot be done if you do not address maybe the most important questions, the trust and the ethical aspect. Because today I should say that there is no question what AI or technology can do. The question that we need to start to answer, to tell ourselves, is what should it do and what should it not do? Because it's extremely important when we start to move into the field of real-world data that we have ethical considerations, because it will be extremely simple today and the future to build these AI models. And often organization is discussing and saying we have a lot of data. And then I often say that, okay, but how did society look like when you capture that data? Because you will have bias in your system. Because the most of the systems that have collected data has had some kind of human interaction. And a really good example is one of the quality registers in Sweden around heart that has been maybe one of the most famous one from a Swedish perspective. Just recently, they realized that the data captured around the heart was mainly done by older men that has not understand the awareness of women. So you have a bias for like 50% of the data that you have captured. So if you start to build an AI model on top of that famous data, as I said, you will have this old fart that is not understanding women, making a digital representative of that person so that can stay alive forever. So I think it's extremely important in this field to have these kinds of consideration around the trust and extremely a lot of ethical discussions. And there's why we really feel that the way that we would like to engage through you to do this collaboration, exploration, how could technology in fact transform part of your journey and part of the way that you engage with the healthcare system. But at the end, it's extremely important for all of us that we keep the trust from the patient and the healthcare system. So with that, I thank you, and I hope that we can make really impact together.